Hi, today I'm going to demonstrate for you how to give a subcutaneous insulin injection. So as with any medication, you want to keep in mind the 6 rights of medication administration. That is to make sure you have the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. So for this demonstration, we are going to look at the doctor's orders and the MAR, and we see that he has ordered for Mrs. Hen a dose of insulin. So we're going to go to the medication cabinet and find our insulin. We'll do hand hygiene before handling the vials. We're going to look at the vial and make sure that we have the correct type of insulin. In this case, we'll say Lispro. And you're going to just make sure that the vial is intact. If this is an already opened vial or a multi-use vial, you're going to check to make sure that it has not expired, that the first person to use it has written on the bottle when it was first opened, and the use by date, and their initials if you have any questions. If this is a new vial, then you would want to do that documentation on the bottle as well. So this vial is good, it is not expired. You do have 30 days to use insulin before it expires. So we will find a 100-unit syringe, or an insulin syringe, and we are going to draw up 40 units of this medication Lispro according to the doctor's order. So before we use the vial, we're going to take an alcohol prep pad and just clean off the top of the vial. Okay. Uncap our syringe, put it on a clean surface. Hope it doesn't roll away. Okay. Draw up into the syringe air in the equivalent of the dose you need, so 40 units. Inject that air into the vial and then flip it over to 90 degrees, and you are going to pull back on the plunger until you get the 40 units that you need. Check for air bubbles. You can tap your syringe if you have any. Okay. And we're going to flip it back over. Withdraw. Check, make sure I have the 40 units that we need. And then using a one-handed scooping technique. Oh, it's a rolly guy. My goodness. There we go. We're going to scoop up that cap, and then you can push it on. Okay. I used my finger there to stop the cap from rolling. Ideally, you would not do that. So then with the cap on, I'm going to find another nurse to verify that I have 40 units drawn up before I can go into the patient's room and administer the drug. So I'm going to take my medication to the patient's room, knock on the door. Hello, Mrs. Hen. How are you today? I have an order to give you 40 units of insulin Lispro today. So I will then perform hand hygiene. Come over, put on my gloves. And for a subcutaneous insulin injection, you have a variety of sites that you can use. You want to make sure that you're going to be injecting the medication into subcutaneous tissue. So you want to make sure that you choose an area that has a good fatty amount. So a great place is the abdomen. You want to make sure you stay away from that umbilicus. So give an area around that area that you don't give the injection. Stay out farther. You can use the backs of the arms and the tops of the thighs. You could also, in someone you're having a hard time finding a place to give it, you could do the upper buttocks. Okay. So I'm going to explain to Mrs. Hen what I'm going to do. I'm going to give you a subcutaneous injection. So I'm going to just pinch up some of your skin and fat and give you a little shot. It should not be painful. And the reason for that is the doctor wants you to have your shot of insulin before you eat. So I will take alcohol pad, and we'll say for the purpose of this demonstration that we're going to give the shot to her in her abdomen. That allows the quickest absorption of the insulin. So we'll wipe off the area using our alcohol pad, starting in the middle and working our way out. I'm going to uncap my needle, pinch up, and for an obese person, you're going to go in at a 90-degree angle. For Mrs. Hen here, we're just going to do a 45-degree angle. So insert the needle, okay, and we're going to stabilize the syringe with the non-dominant hand, and then slowly inject the medication. Okay, and smoothly, and at the same angle that you inserted the syringe or the needle, you're going to withdraw, put it into your Sharps container to maintain safety, and then if you have a little bit of leakage or a little blood, gently pat with a gauze pad on the site. Do not rub or massage the area. You just want to gently pat. After that, we'll make sure that Mrs. Hen is doing all right. She doesn't have any questions. I'll take off my gloves and we'll go make sure that we document in the MAR the medication that was given, the site of injection, and how much medication was given. Let's see. Also, we'll put that in the nursing notes, so it's documented twice. If for some reason you had a need to mix two insulins together, you should remember to do clear before cloudy. So you would want to insert air into the cloudy first, and then your clear, and then draw up the clear medication that you need, and then drop the cloudy medication. Now that's not something that happens a whole lot anymore, but that is how you would do it if you run into that situation. And that is my demonstration on subcutaneous insulin injection. Thank you.